Welcome back. In this module, Module 9, we're going to be shifting our focus onto the body's largest organ, your skin. So I want to dive right in and talk about how red light actually supports your overall skin health. Most people think when your skin health starts to weaken, it's primarily from sun damage or just old age, but there's a lot of other things under the surface that come into play. Things like overall stress status, poor sleep, toxins, inflammation, all of these things increase and accelerate aging. So, red and near infrared light help to restore that foundation under your skin. So, what does red light do at the skin level? One of the main things it does is it's going to stimulate fibroblasts. And fibroblasts are the types of cells that increase collagen and elastin production. They're the construction workers that rebuild your skin's framework. Another thing that red light does is it improves your microcirculation. So that's blood flow to the area, which is going to improve oxygen flow, improve nutrients, which is ultimately going to bring on quicker healing. Another thing red light does, it's going to reduce overall inflammation, which is going to calm your skin, which is going to give you healthier aging skin. And lastly, one thing that we talk about all the time when it comes to red light therapy is it improves and accelerates cellular turnover. This is improving the function of the cells, the mitochondria of the cells, and this is going to lead to less fine lines, improved skin tone, smoother skin, and it's actually going to help improve actual scars as well because your scars, the tissue in your scars is constantly turning over as well. And if we can improve the type of tissue that is replacing the old part of the scar, you're going to see improvements in the scars. So let's dive into some clinical research, some evidence from some human trials. The first one is a study in the Seminars of Cutaneous Muscle and Surgery from 2013. And so this looked at multiple red and near infrared light sources or devices in a review of multiple human trials. It found that red and near infrared light therapy improves, as we mentioned, collagen density, skin elasticity, fine wrinkles, roughness of the skin, overall facial texture, and they broke it down into multiple different areas along the study. And they used specific research studies to just focus on skin rejuvenation, just a bunch of other bullet points similar to things like acne, burns, photoprotection, which is the skin's ability to protect itself from the sun, overall scars, like we mentioned, and quite a few others. There's another study that was a randomized control trial in the Journal of Photochemistry and Photobiology. I love this study just from the name alone. This is from 2007, and it's called a prospective randomized placebo-controlled double-blinded and split-face clinical study on LED phototherapy for skin rejuvenation, clinical, profilometric, histologic, ultrastructural, and biochemical evaluations and comparison of three different treatment settings. So in this study, or in this study, they took four different groups. One, they gave a sham light treatment. One, they gave just red light. One, they gave just near infrared light. And the last, they gave both red and near infrared. And so some of the things that we saw with this study is a reduction of wrinkles up to 36%, improved skin elasticity up to 19%, a statistically significant increase in the amount of collagen and elastin fibers in all treatment groups. And so in this study, they actually looked at the histology, which is the type of tissue, and they saw improvements in quite a few things, which is the status of the matrix of the metalloproteinases and their tissue inhibitors. They saw changes in the mRNA levels of interleukin 1SS, tissue necrosing factor alpha, ICAM1, and connexin 43. And they also saw a reduction in interleukin 6, which is a potent inflammatory marker. So, in other words, they saw an improvement of a whole bunch of really good things in the skin, and they saw reduction in a significant inflammatory marker in the skin for all the treatment groups, the red, the near infrared, and the treatment group. They got both, but they didn't see any of that in the sham light study. So the patients receiving the red light, they saw improved collagen production. They saw a significant reduction in wrinkles, and they saw better skin moisture and tone. And the coolest thing about all of this is that all of this is based on two treatments per week for only 4 weeks. So Red light doesn't work by stretching or burning your skin. It works by nourishing the cells that build your skin. That's why the results leave you looking more youthful and not artificial. So, most people who regularly use red or near infrared light, or both, they see brighter complexion, fewer fine lines, faster healing of the skin, better hydration, reduced redness or rosacea, just overall softer, healthier skin tone. So, red light therapy doesn't mask aging, it just supports your body's ability to repair and renew your skin. We'll see you in the next module.